Good morning. I'd like to thank the NISAC delegation, the county officials from across the state for joining today's webinar. We have over 100 individuals on this webinar here today, obviously a sign of serious concern in our communities. Today's May 22nd, 2024. I'm Stephen Aquario, the Executive Director of the New York State Association of Counties, and today we're talking about a campaign that the Association of Counties and Coroners and Medical Examiners Association started a few short years ago, but during the COVID years, it was sort of tabled and it is now returning in our communities. And we wanted to bring a sense of awareness to the counties about this campaign, which is called See the Sign, Save a Life, a turnkey opioid campaign for your county. And that's exactly what we're going to walk through today with our partners at Trellis Marketing from Erie County, New York. Again, welcome. This is a NISAC webinar about an award-winning See the Signs, Save a Life campaign. Today, we gather for a shared purpose to combat the devastating opioid epidemic that has affected so many lives across our state and nation for decades now, and in particular, recently becoming more devastating in our community. Just yesterday, I talked to the former Erie County Executive, John Flynn, and we had a very powerful conversation about the prevalence of cocaine laced with fentanyl, first-time users, long-time users of these types of drugs, substance abuse, unfortunately, dying after just one use, with products being laced with fentanyl. Drug dealers don't care if individuals die. If 9 out of 10 people who buy their product live, they return and buy more. And if one perishes, that's one life lost. Counties have been at the forefront of this battle for years. Before the COVID pandemic, every single day, tirelessly working through various agencies, including social services, health departments, law enforcement, jails, 911 dispatch, district attorneys, public defenders, probation, coroners, medical examiners. We sued the manufacturers of opioids. We sued the distributors of opioids. We sued the pharmacies for distributing too many pills in our communities. This comprehensive and coordinated effort underscores the critical role that your counties and counties across the state have played in tackling this crisis. But we're not done. Following a spike in overdoses in 2017, NISAC and the New York State County Coroners and Medical Examiners Association, in particular, Scott Schmidt as its president, we came together in the spring of 2018 with a common goal, educating the public about the signs of opioid abuse that were right in front of us all the time. Getting help to those in need before it's too late. Our associations never partnered like this before. We sought to do this through a powerful video, a public service advertisement that didn't shy away from the reality of this situation, that opioid addiction leads to death. Created in partnership with Trellis Marketing, the See the Signs, Save a Life campaign aims to raise awareness, educate our communities, and ultimately to save lives. And throughout its inception, this impactful campaign has been a broadcast on television stations throughout New York State and is in fact the recipient of a Marketing and Communication Award in 2018 from the Capital Region Marcom Awards. But despite our efforts, and as you'll hear today, we have seen a sharp increase in overdose deaths in recent years, driven primarily by synthetic opioids like fentanyl. Fentanyl is 50 to 100 times more potent than heroin and is often mixed with other drugs, unbeknownst to the user. This has led to tragic increases in fatalities, and you'll hear some of that today. In 2023 alone, we expect the number of opioid-related deaths in New York to exceed 5,400 people, an 80% increase from 2018, 400% increase from 2010. The See the Signs, Save a Life campaign is built on the premise that awareness and early intervention can and does make a difference by educating ourselves and our communities about the warning signs of opioid abuse and overdose, especially those involving fentanyl. We empower each other to act swiftly and effectively. Today's webinar will introduce you to this turnkey resource and discuss how it can be customized in your county to meet your community's unique needs. Before we begin with today's presentation, I want to go to Jeanette Stanziano for a brief housekeeping remark.
Thank you, Stephen. We will be recording this presentation as we always do with NYSAC webinars, and we will be posting the recording with the PDF of the slide deck on the NYSAC website at www.nysac.org/webinars. We also want to encourage you to feel free to submit questions at any time during the presentation by referring to your dashboard questions tab. Just click on the questions tab, type in your question at any time, and your questions will be addressed during the Q&A at the end of the program. Back to you, Steve.
Thank you, Jeanette. Let me introduce our speakers for today, and they will speak in this order. Scott Schmidt. Scott is the Chief Coroner of Orleans County, a dear friend to the Association of Counties, has worked tirelessly to save lives related to fentanyl and opioid abuse. Scott has served as the Orleans County Coroner since 1990. Was appointed Chief Coroner by the Orleans County Legislature in 1997. He's been a very active member of the New York State Association of County Coroners and Medical Examiners since 2000, and is the association's longest serving president, a position he has held since 2006. Catherine McCracken, the founder and CEO of Trellis Marketing, also a great friend to the Association of Counties, to Erie County, and to counties across the state. Catherine has devoted her entire career to marketing and advertising industry since 1984. Her extensive experience spans 22 years in broadcast media, followed by 18 years of helping businesses, local governments thrive through Trellis Marketing. Amanda Lucchino is the Director of Business Development at Trellis Marketing also. Amanda brings 20 years of marketing experience to the table, spent 8 years as a professor at Niagara University and SUNY Niagara, specializing in business and event management. Thank you to our guests for taking the time to be with us here today. Tough subject matter. Let's get right at it. Scott, we'll go to you first, followed by Catherine, and then Amanda, and we'll save some time for questions. We'll keep this to about an hour. Scott, to you.
Thank you, Steve, and thank you, Amanda, and thank you certainly to Trellis Marketing and Catherine, all of whom have become great friends of every citizen in this state. And we began our journey into this campaign through the New York State Association of County Coroners and Medical Examiners, which I'll refer to as NYSACME from here on, way back when in, I believe it was 2018. And we were sitting at a board meeting in Syracuse, and we have 4 board meetings a year with various medical examiners and coroners throughout the state who represent various regions. And one of my board members, Dr. Robert Cole, who was the coroner in Steuben County and still is a retired surgeon. And we were sitting around the table and discussing our normal items of business on what are the latest and greatest, tools to use in medical legal death investigation, and planning our conference agendas for the upcoming educational conferences. And out of the blue, Dr. Cole just said, "Can we just stop for a minute? I've got something I want to address." And Dr. Cole had recently had 3 or 4 overdoses within 2 weeks of people between the ages of 20 and 30 in his county in Steuben that were overdose deaths. Now, we were all familiar already with the increase in overdose deaths from opioids in our counties. We were all certainly aware of the lack of funding that had come down through the medical examiner's offices and coroner's offices, where they were short-staffed and asked to do more work with less. And Dr. Cole wanted to know if there was anything that we could do to try to curb these accidental preventable deaths in this state. And so we brainstormed for a little bit, and we could do this and we could do that. And we came up with the idea of, why don't we spend some of our money and do a public service announcement and let people know what the dangers of using these opioids are, and what the dangers are of the fentanyl that has come into play that is causing deaths of people that are using opioids, whether it be for pharmaceutical reasons or whether it be for recreational reasons. And so we talked about how we wanted to do things, and I said I'd look into it, and popped into my mind while watching a Sabres game, and a Trellis marketing commercial came across, and a very simple ad that just drew you in and said, hey, you know, if you need something that you want to promote, we're the people to do it. And that was the general message I got from this very simple ad, who the only person in the ad was Catherine McCracken from Trellis Marketing. So I promptly called her and asked her if she'd be interested in working with our group and maybe coming up with some ideas. And so Catherine put together some stuff, and she came to our next board meeting in Syracuse on a Saturday morning. And she brought with her some ideas and some storyboards and wanted to know some more information about how we wanted to go about this and what direction we wanted to go in. And we told her flat out, we didn't want the touchy-feely-good, campaign about, oh, well, we're sorry you have this problem, we want to help. We wanted an in-your-face message that drove home the statement, either get clean or die. And we wanted visual representation of the horrors of an opioid overdose death. She took all this information back, and she worked with her team and called me 2 or 3 times and said, we've got something that we want to run by you. And you said you wanted something that's in your face. And our marketing team and our creative team are working diligently to do that. And we need to borrow something. We need to borrow your coroner's coat if you have one. And they took my coroner's coat. And so some time went by, and they came back with the See the Signs, Save a Life campaign, which was a little bit different because it actually, as you will see, goes backwards in time. It starts out with a picture of a dead person with a needle in their arm, laying in a bathroom. And it wasn't your stereotypical, poor person in a ditch, homeless. It was a middle-class, upper-class individual in an affluent neighborhood that was popular in school. He was a high school athlete, and he had gotten addicted to addicted to opioids for painkillers because of some sports injury. And it goes backwards through the video about how, the one brother should have recognized that things weren't right, and the father should have recognized that things weren't right. And it ends in the second to last frame, if I recall, that the father is reading a paper with the headlines, opioid deaths on the rise. And then it shows a final shot of the dead person on the floor in the bathroom with the needle in their arm, and this time with the person standing over them wearing my coroner coat. So you can see the word coroner. So it does send that message, get clean or die. And this was a tremendous product that Trellis put out that we had no clue that they could even come close to what they did. Working with them side by side and was just such a rewarding experience because they got the idea. They got the message. They understood what we wanted to bring across. And to this day, I had just marveled at the fact that throughout this whole process, this commercial, after we have re-upped with Orleans County to do this through an organization that started before our campaign, but has been revitalized, Orleans Recovery, of which I am acting president of here in Orleans County. We've used Trellis to redo our website, to revamp our mission statement, and to help us with new literature, with new logos, and to get the word out there that get clean or die. And we use that logo, we use that message, we use some literature that has See the Signs on it that we include in Narcan kits. And we have given away hundreds of Narcan kits with these informational brochures on See the Signs throughout the county, at the Orleans Fair last year, at the Medina Festival Lights Parade, This year, we're on track to give them out at the Strawberry Festival next weekend, at the Orleans Fair again, at the International Overdose Awareness Night, and at the National Night Out as well. And it's because of the powerful and impactful message that Trellis Marketing put into visual and into words in the script of this commercial that we're able to do all this stuff and plus get the money from the state opioid grant funds, that we're getting that word out there. We're getting that material out there because we realize that people are still going to use, but they need to be aware of what they're using. And in these kits with the Narcan, we're also including fentanyl test strips, because while we can't stop everybody from using drugs because they don't care, because addiction is a disease and this is on the rise and it has risen tremendously and exponentially since the pandemic and during the pandemic, we want people to understand, to see these signs so that you can save a life by having Narcan available, by at least giving them a test strip so they're not taking the drugs that they have to function every day that are tainted with fentanyl. These are preventable deaths. These accidental deaths are preventable 100%. And if we save one life, the money we spent through NISAC with NISAC is worth every penny. And when Catherine came back to us and said, well, this program is going to cost, I think it was $50-some thousand. NISAC, not-for-profit organization, is not a mandatory group to belong to if you're a coroner or medical examiner in New York, but we're a volunteer one. So we don't have any state funding. It's all by volunteer. It's all by fundraising. It's all by conference expenses and tuitions. And I reached out to my friend Steve Aquario, who I met when I first became president of NISAC. He actually invited me to come to Albany for lunch because he said he wanted to get to know me and that the two organizations could ultimately help each other. And by golly, in 2018, I reached out to my friend Steve Aquario and said, hey, I've got this idea from our association and we need some money, and wondered if you'd be willing to maybe give us some to maybe even bolster half of what it's going to cost to do this. But this is why we want to do it, and this is who we've talked to, and this is what we want to do. And without hesitation, Steve Aquario, Executive Director of NISAC, and my friend said, you got it, we're in. And off we went to the races. And here we are today, redoing this same campaign because it was so influential. And because it was so influential, and because of the funds that Orleans County received from the state opioid settlement funds, this commercial actually ran in our market in Orleans County during the Super Bowl on national TV in our local market. But still, during the Super Bowl, where people are paying millions of dollars for 10, 20, 30-second ads, ours is on there. See the signs, save a life. One great thing that we did out of this whole campaign is we also had Trellis not only do all our literature and material that we hand out, but we also had them, when we first started it, put this commercial on a thumb drive. And we gave a thumb drive to every one of our 140-some members at the time. We also brought it back to our county. I gave a presentation to the county legislature and gave a thumb drive to each department head in the county to put on their department website throughout the county. So this message is out there. It is working. It is affecting people in a positive way. We are saving lives, albeit one at a time. But the $50,000, if it saved one life, is worth every penny that we paid to have Trellis design this and put it forth in programmable mode. And we thank them from the bottom of our hearts.
Scott Schmidt, thank you so much for what you have done and what you continue to do in partnership with the Association of Counties and Trellis Marketing. Catherine McCracken, the founder and CEO of Trellis Marketing, working with Erie County, working with NISAC and the Coroners and Medical Examiners Association. Let's hear from you.
Okay. Hello, everyone. Thank you so much for your time today in joining us. We're thrilled to be sharing with you today our See the Signs, Save a Life campaign that hopefully can help you best utilize your opioid settlement funds for your county. Just to give you a little preview of what we are about to see, we are presenting a turnkey system for you that of course includes the award-winning impactful creative, but also allows you to hone in on your county's residents with impactful messaging that educates family and friends on the signs of opioid abuse. So we're recommending a year-long or longer cooperative campaign for each county that's easy for you to implement and also ties all of your existing efforts in one place. So we're making this very turnkey and easy for each county. Now, further in the presentation, you're going to see some very interesting research that we uncovered from the CDC that states that long-term strategy results in the most impact. So the highlights of this system are the following. Number one, we are going to customize this creative that you are about to see for each participating county. So it will drive viewers to the link, whether it's your website or a landing page that we build for you, and the creative will have a QR code in it that will be, obviously people can use to go directly to help. In addition, beyond the 30-second version of this creative that's running on the streaming video, we're also going to customize a 60-second version for you. And that should live on your website, but also would be a very useful resource for you to share with your community partners. A lot of different ways that you might be able to use that out in the community, for your outreach and education. Okay, I think we can, if we can queue up the creative now, then we'll get into the nuts and bolts of what the campaign is.
He didn't want to play with me anymore.
He said his muscles hurt. I guess it wasn't just a hard workout.
I just thought he was busy with school.
He was missing a lot of practice. I should have asked what was wrong.
I didn't see the signs, and now it's too late for my son. See the signs. SaveAlife.org.
Amanda?
Yes.
Amanda, let's go to you, Amanda. Let's talk about, you bring 20 years of marketing experience. Catherine just showed a very powerful video. Literally, I'm in tears. I'm not kidding. It's incredible. That could happen to anyone at any time, anybody's neighbor, family, friend, a member of our community at large. You bring 20 years of marketing experience to the table here. How can counties take advantage of this and help implement and bring this to their community?
Yeah, thank you. Very heavy, right? But super important. We felt it was critical to speak to the friends and family of the addict and to educate them on the signs of abuse. And remember, we're also making a 60-second version that you can use in your community efforts, and you'll be receiving a follow-up after this webinar with both the 30 and the 60 creative. Jeanette, if we want to move to the next slide. Okay, so we heard from Scott. This is a quick reference to the campaign background. Our objectives with this campaign with every county, very clear. Number one, equipping you to educate your residents about the signs of opioid abuse, and then direct your residents to help. And also important, looking at your resources and making sure everything is unified and it ties all together. Next slide, Catherine.
Yep. Our original campaign in 2018 was broadcast throughout New York State and on social media channels. We only had, it was a small budget to be sure for, an entire state. And we were able to run with this modest budget for 12 weeks. What was surprising to us, though, was the massive response to this across the country. The campaign went viral with 118 different media outlets in 25 states picking up and reporting on this campaign, reinforcing in our minds that the opioid epidemic is the biggest problem in every county in the country. Next slide, please. And of course, we were so pleased to learn that our creative won that prestigious award in the Capital District Marketing Industry Award Show, highlighting its significance and success in community health initiatives. And, yes, it won this award, but even more important is that this creative remains a powerful resource for you to educate your residents on the signs of opioid abuse. Next slide, and Amanda.
I should also mention, going back a little bit, that in 2018, we purposely built this campaign to be useful for years to come, knowing the need to address this as the problem was not going away. So fast forward to present day, our friend Scott, who you already heard from, reached out to us just last fall to revisit running this creative in Orleans County. And Jeanette, can we show Scott's creative for Orleans Recovery?
He didn't want to play with me anymore.
He said his muscles hurt. I guess it wasn't just a hard workout.
I just thought he was busy with school.
He was missing a lot of practice. I should have asked what was wrong.
I didn't see the signs, and now it's too late for my son. See the signs. OrleansRecovery.org.
So you can see there that we've customized that for Scott with the use of a QR code, taking people to the landing page, additional branding, and the wrap up at the end. So Scott, you want to recap on what we particularly did for your county, just quickly, briefly mentioning how you used those rack cards.
Yeah, sure. Orleans Recovery was started before this campaign even came about. It was started here in the county by a group of parents that had significant trauma in their lives because a loved one had passed away from an opioid overdose. Most of the parents were parents of children, of teenage children or children in their 20s. And it was called at that time, Orleans Recovery Hope Begins Here, which was sort of a large, cumbersome name. The group met and they had two different support groups within their group. One was called the Jesus Factor, which was more towards a religious aspect of recovery. And the other one was called Missing Angels, which was a support group designed for parents who had lost their children. This group went along and did some fundraising and ultimately got me involved, wanted me to come to a public meeting as a panelist to answer questions about the coroner's office and what the deaths were like as far as opioid overdose deaths in Orleans County at a local fire hall. And there were probably 75, 80 people there. The sheriff was there, myself, a bunch of the drug treatment folks here in Orleans County, some mental health folks. And I get down there and all of a sudden I'm the only one sitting at a table and one of the founders of Orleans Recovery Hope Begins Here, introduces me as the keynote speaker for the night. And they were all trying to figure out how they were going to spend some money because the sheriff wanted to start a treatment program and a support program in the jail for the inmates. And, all the treatment folks were there. And, the long story short is I came out with a whole different message. I told them that they should have some kind of a treatment program and support group for the inmates, but the majority of the money should go to law enforcement to keep this out of our county, period. And so I became intimately involved in this organization by default. Membership has dropped off as far as our volunteers, as it has in every organization. And we found ourselves having meetings with about 4 or 5 people max. And to try to do fundraising and things was becoming not a good thing. And we were watching our checkbook get down into critical mass. And then all of a sudden, we had an opportunity to apply for grant money to Orleans County that they received from the state opioid settlement fund. So I couldn't let this go, and took over as acting president and got a couple of the former members to come back. And we applied for a grant for $50,000 to rebrand our association and to revitalize our membership base and to get our mission statement out there and to actually do something that was going to be beneficial to the community. And so out of the 50, we received 35,000, 20 of which was earmarked for remarketing, rebranding, and 15 for other incidentals and for different things that we're still continuing to do. So I reached out to Catherine and said, hey, you did such a great job with See the Signs, Save a Life. We want you to do this. So I had her with the assistance of my daughter, Haley, who is a clinical mental health counselor with the Orleans County Mental Health Department. She designed a logo, which was a compass to try to get across that we are going to try to point you in the right direction in life with hope, motivation, recovery, and action. And so Orleans Recovery is a community support organization that has cogs in a wheel and a compass where we can refer people to treatment programs. We can still have our support groups, which we still offer and still hold. And we now have some funding that we had to produce some literature and some wrap cards that we not only have out on tables at various events, but we include in the Narcan kits, which we had little bags, satchels made up, if you would, sort of like a small lady's purse where we put 2 vials of Narcan in, and this latest creative, I guess is the word, brochure with our new logo. And the new logo on the particular literature that Trellis came up with not only has the compass on it with the words to hope and recovery and all that, but it also has a rising sun against the background of darkness in a mountain and a roadway and a path on the roadway going up to the rising sun with that compass. So it's very powerful, very impressed, and very well received by everyone who's seen it and who receives it. It's got our QR code on the literature as well. And that goes in the packet that has our logo on it and with the Narcan in it. And last year at the Orleans County Fair, just by having a booth and a sign that says free Narcan, no questions asked, we have people sign a piece of paper saying that they've taken a Narcan kit because we have to qualify that with the health department. We train them on how to use it. It's nasal spray. It's no longer injectable, which takes a lot of fear and angst out of people that used to want to train and use and give away Narcan, but they were afraid of the needles. So there are no needles involved. And we gave away over 200 kits at the Orleans County Junior Fair last year in a week. And then we gave over, I think it was 65 or 70 at a one-day event where we were there for 3 or 4 hours in Medina at the the Medina Festival of Lights. We had a presence at the International Overdose Awareness Night in Batavia, New York, where we gave away our literature, but we had other folks doing Narcan there. And we also had a presence at the National Night Out in Medina, New York, which was an event promoting drug and alcohol-free activities for families. So this idea, this see the signs, save a life, has come full circle, where we're out there actually spreading the news. We're actually making a difference by providing tools to save people should they find someone in a situation where they've overdosed. And with the overdoses on the rise here in Orleans County, in this month alone, so far we've had 3 overdoses, and they were all saved, thank God. But that doesn't even come close to what's going on around us that we don't know about, that people might have gone to a different county in a hospital, or, certainly our overdose deaths in this county, we've had probably 6 to 10 this year so far total. But just the fact that 3 of those overdose in the month of May have been saved because of either law enforcement using Narcan, fire and EMS using Narcan, or just the general citizen being on scene and having a Narcan kit. And by giving as much Narcan out in the community along with the fentanyl test strips, we feel we're trying to make a difference, and we are making an endeavor to save lives, period, but one at a time. And if we save one life again, it's worth every dollar spent.
Thank you, Scott. Thank you. Jeanette, next slide. Here are actually, let's see here. If we actually fast forward to the next slide. Here are the digital display ads and landing page that we created for Orleans Recovery. Just kind of to give you an idea of what we did. And Jeanette, next slide. And here are the rack cards that we created that provide additional resources, but also features the QR code that again takes people to the landing page, which ties the system all together. Jeanette, next slide. Thanks, to you, Catherine.
Okay. Earlier, we referenced the fact that it should be a year-long campaign or longer, and here's why. Because according to the Centers for Disease Control and Prevention, when campaign messages are aired at sufficient levels of reach among the target audience, one can expect change in campaign targeted knowledge and attitudes in 6 to 12 months and changes in behaviors in 12 to 24 months after campaign launch, which means we're going to be fighting this fight for a long time. So if you're ready to proceed or you're interested in a campaign for your county, let us know after after this presentation, and we'll make a recommendation specifically for your county. So let's go over the elements of each of the campaigns. So number 1, video production. So we're going to customize the 30-second and 60-second PSA for your county. Number 2, non-skippable streaming ads. We chose streaming video ads because we're able to target only residents and serve these ads only to residents in your county. And additionally, you'll have digital display ads that will also only be served to your residents. And then beyond that, when we meet, we can discuss supplemental options that you may want to add to your campaign. Do you do community or trade show events where you might need a pop-up display? We can design that and print it. Do you need printed materials like the rack cards that Orleans County used? Might you want to do posters for schools or throughout the community? So really anything that's in the range of what we do in advertising and marketing, we could help you with. So many possibilities. So those were just a few. Next slide, please.
So Yep. So you might be thinking, where is our 30-second PSA running? This is just a little glimpse of some of the premium content areas where it will be seen, including what you see here. This will run on individual networks such as HGTV, the History Channel, Discovery, Fox, Food Network, CBS News, TLC, and it will be also running on streaming platform providers on your smart TV like Fubo, Sling, and Zumo. And just as a reminder, these are all unskippable ads. Next slide. And one of the things we like best about streaming video is that we're able to track the people that were served your ad and when they went to your website or landing page. So we'll be sending you a monthly report with that data. Jeanette, next slide. And along with your streaming video, you will receive digital display ads, and we will be crafting that for you in 5 different sizes, seen here. Next slide, Catherine.
Yep. And so just to recap, what you'll be receiving, you'll have your 30-second PSA, your 60-second PSA for your website and community outreach. You'll have a robust schedule that's running on streaming TV along with the digital display ads and custom reporting on all of it. Next slide. So we wanted to give you, we did this breakout, we wanted to give you an idea of what our investment recommendation would be based on your county size. We wanted to show you some pricing examples, and we thought the best course of action would be to look at it by county size. So we divided all the counties into small county, medium county, and large county. And you can see here that we used Livingston County to represent a small county. And small to us, when we looked at this, meant 79,000 residents or less. And then to represent a medium county, we used Niagara County. And a medium county would be any county that has between 80,000 and 494,000 residents. And then for large county, we used Westchester as our pricing model. And a large county is any county with a population of over 495,000. So I want you to know that the pricing for the program is made up of 3 different investments. One is, 3 different investments. The first is basically a project management fee that also includes a 1-year creative license fee, which means we are authorizing you to use our creative, and as well as graphic design and production updates. Those are all covered in that one project management fee. So the only other 2 elements that make up the investment is this is your actual media. So the streaming video media and also the digital display ad media. So we've outlined a recommendation for each size county. And for a small county, we're recommending a $90,000 spend over the year. And for a medium county, $150,000 spend. And for a large county, a $230,000 spend. And this is over a 1-year period. But when we meet with you, we will figure out together what the right investment is for your county, and then also discuss any other options that that we can customize for you as part of your program. Next slide, and Amanda.
So this is just supplemental stuff. Again, like Catherine mentioned, we're going to go right by this one to the next slide. Jeanette? Okay, and here we are at the end. I see that we might be running a little short on time, and we're happy to make all the time you need. But to wrap this up, we want to make sure to mention what comes next. Again, we will be passing along this presentation to you and the PSAs. And those of you who want to participate, please feel free to reach out to the contact information. I believe we're going to be able to put that in the chat, and it will be passed along to you in your inbox after this presentation. And so we do have some time, I believe, to field some questions here. But just to wrap it up, I want to say thank you so much. We look forward to working with this on this campaign with you, and hopefully we'll hear back from all of you. But for now, any questions that we have, we're happy to answer.
I'd like to thank our presenters today, Scott Schmidt, Chief Coroner of Orleans County, Catherine McCracken, and Amanda Lucchino from Trellis Marketing. We do have a few minutes. We do have a few questions. The first question is would you be willing to work with a regional approach so that the 4 or 5 counties who work in a particular region, or for instance, in a Western New York region, there's an intercounty out there with 18 counties. If they came together to save costs, or could they do a regional approach in working with you?
Yes, I'll take that. We absolutely can do all of that. That's the beauty of doing this customization. And if it's more counties, it's probably going to also make sense to buy broadcast television in addition to the streaming video. So we would obviously run the streaming video in the footprint of whatever it is, however many counties it is, that makes sense there with the schedule, but it also could make sense for broadcast then. So yeah, sure, we are absolutely on board with that idea.
Okay, if there are questions from our guests, just type them into the chat line here, and we can pick up the questions. A few more here. Are these resources that you're developing here, can you translate that into multiple languages?
Yeah, we sure can. There's companies that we've worked with. We did a really wonderful campaign for the Niagara tourism people in Niagara Falls, USA, and we ran it in Toronto and had it translated into several dialects of Chinese. So it was interesting. So we've done it, and it's very, very possible.
Okay, another question, can the campaign be tailored to address specific issues in a particular community, perhaps related to fentanyl?
At this moment, the creative can't be changed, although, spoiler alert, we are working on ideas because we plan on doing this for a very long time. So we're working on additional concepts and creative for the future, and we would welcome from the counties your thoughts on that. And so that would be a very obviously a very important thing to address. So we welcome your input on that.
Okay, I'll take just a couple more questions here. Measuring success of a campaign. Any thoughts about how you could measure the success of this type of a campaign?
Well, we're going to have the monthly reporting that is going to track the people that were served the ad, and did they go to your website or landing page, to see those resources and get help. It's a long haul. I don't know how that actually. I can't promise that we can touch and feel, especially when this is such an issue and over such a long period of time. So I'm sorry, I'm not quite sure how to answer that beyond what we can track from the advertising.
Oh, that's good. That's good. And then the last question here, I'll end with this for our attendees. Resources. Do you have any suggestions, or are there resources available to help support the rollout of this campaign?
Well, I think that would be a discussion point with each county because, we can create anything that makes sense for you depending on what you're doing out in your communities. We kind of covered a lot of those ideas earlier, but honestly, part of the magic of this would be being able to create those resources, whatever anybody needs, whatever, how to incorporate it into what you're doing on a daily basis and what you've already got so that everything is connected and it flows.
Let me thank our guests today for putting in their time, their attention to this matter in our communities. Catherine McCracken and Amanda Lucchino from Trellis Marketing. You can see how to contact them there directly. You could also reach out to NYSAC and contact us at info@nysac.org. That's info, I-N-F-O, @nysac.org for additional information. Let me give the last word to Scott Schmidt. If you're with us, Scott, please sign us off.
Well, thank you, NYSAC. Thank you, Trellis. And thank you to everyone who has jumped on this campaign and who realize what a problem and an epidemic opioid overdose deaths really are. And I can only say that as a coroner for the past 30, 40 years, and on behalf of my medical examiner colleagues and other coroners throughout this state and for that matter throughout the country, we are tired of doing our jobs in this vein. And especially since opioid overdose deaths are preventable. And while they're accidental, if we jump on the bandwagon and be more cognizant of what's going on around us and how people are reacting, and make strides to try to help them once we see those signs, that we can save lives. And there's nothing worse than having to talk to parents who have lost a child, who are insistent that their child did not use drugs, and to come back with a death certificate and toxicology report and show them the evidence. And this is a preventable thing, and we should do everything in our power to try to prevent it. And with that, I say thank you, and give this program, give this idea, give these words of advice, keep a sign, save a life, some serious consideration in your county. And thank you for having me on this panel today.
Thank you very much. This will conclude today's webinar on See the Signs, Save a Life, a turnkey opioid campaign for your county. Thank you very much for joining us today.